Okay, because when I'm sharing, I can't see the button. Okay, so as I said, this is the Health and Care Professional Internship Program. We're now into cohort 2 of this, so I'll tell you a little bit more about that. So we're open to recruitment now for the second cohort of the HCP program. So just to give you a little bit of insight into what it's about. So the program provides funding and support for health and care professionals to advance their knowledge and skills in research. So it's aimed at professionals from a wide range of backgrounds and a wide range of career aspirations. There is eligibility criteria, which I will come on to. But essentially, the internships are very flexible and they're individually tailored and bespoke to the intern's needs. So the design is really to meet the needs of and aspirations of each internship, whether they're just starting in research or whether they are looking to develop clinical academic careers as an independent researcher. So it kind of crosses all levels. So the program is funded by NIHR and it's devolved to the region. So it's not a central program, it's a devolved program, if you like. And in our region, it's delivered by the Applied Research Collaboration, Kent, Surrey and Sussex, so ARC KSS, if you've heard of us. But we're really a strong partnership of NHS trusts in our region, the universities in our region, and other organisations who play a vital role in supporting the programme. So the Research Delivery Network, for example, the Health Innovation Network, and also our public advisors. So we're a broad kind of church in terms of the team supporting the programme. So this is the core team. And when I was looking through the slides, I realised we need to put you on here, Rachel, because Rachel is new to the team as well, supporting this.
No worries.
So we'll need your picture at some point. So as I said, so I'm Julie McInnes, Beth is on the call, as is Teresa, and Rachel as well. So I'll give you the email of the ARC Academy during the presentation. And if you email that address, you'll get through to Beth, Teresa, or Rachel. So that's us. We're a very friendly bunch, hopefully. So let's get straight into the eligibility criteria because that's, I think, where we have most questions from people. So this is set by NIHR National, and applicants must be a registered health or care professional from this list. So the internships are not available for doctors, so medically qualified professionals, and dentists. And I'm afraid that is non-negotiable from NIHR because the programme is set up to really support nurses, midwives, AHPs, and others. So you can see there a list of the regulatory bodies. So, for example, the Academy for Healthcare Science, General Chiropractic Council, the General Dental Council and General Medical Council are on this list because they do have other professionals registered with them, not just doctors and dentists. So, but again, that's part of their criteria. The main groups we hear from are the General Pharmaceutical Council, Health and Care Professions Council, and Nursing and Midwifery Council. It is also open to public health professionals, but they must be UK public health registered. So we appreciate that does exclude quite a lot of people working in public health, and that is something we have conversations with NIHR about. So that, as I said, that list is pretty it's non-negotiable, and people do have to kind of apply by that criteria. There are a few other criteria. I'm sorry to start off with the kind of negatives, but this is really the important stuff before we go further. So applicants must be at pre-doctoral stage of their career. So i.e. they don't have a PhD or an equivalent doctoral level qualification, and they must work in Kent, Surrey and Sussex. As I said, this is a devolved programme across 15 regions. So other regions have similar programmes. So if you're not in Kent, Surrey and Sussex, we will direct you or to the NIHR website, which tells you who you need to contact for your region. But I think everyone here on the call is part of our KSS family. So this year we are offering 33 internships. We offered 24 last year, but it's gone up to 33 this year. So it's 33 this year, it'll be 33 next year as well for the final and third cohort. 10 of those internships are ring-fenced for radiographers and pharmacists. And again, that is really stipulated by NIHR in an effort to recruit those underrepresented professions. There are other underrepresented professions, but radiographers and pharmacists have been highlighted where we are trying to recruit those 10 places. Having said that, that does mean we've got 23 other places for other professions. So it's not only open to radiographers and pharmacists, and that's very important to note. So each internship lasts up to 9 months, and the award is up to £10,000 per intern. Organisations will also receive £700 if you're supporting an intern, and that is towards administration costs and mentorship as well. So that's the funding envelope that's on offer. It's not a huge amount of money, but it's certainly some sort of seed funding for staff to advance their research career. Sorry, this says you, but actually it means the interns. So interns will be asked to provide some basic costings. And again, that's where you as managers can perhaps help. But the ARC Academy, particularly Beth, will help with this as well if you have any questions or concerns or need support with costing and application. We've tried to keep it as light touch as possible because we know that can be quite kind of scary for some people. But again, there is lots of help and support available to do that. So hopefully that won't put people off. So the internships are for those with, as I said at the beginning, little or no research knowledge, skills or experience, right through to those aspiring to clinical practitioner academic careers and being independent researchers. So again, there are highlighted under professional settings and regions, but this doesn't mean we won't look at applications from other areas. So we are particularly keen to receive applications from radiographers and pharmacists, as I've just said, but also those working in primary and community care who tend to be underrepresented, local authorities, so by that we mean health and care professionals working in local authorities, social care, so again what we're talking about, registered professionals here, so social workers, and those working in research delivery. So it is open to all those professions and those councils that we've just mentioned, but we are particularly keen to get applications from those groups. So there are 4 levels or types of internship, and these are on here because we ask the intern in the application to identify their level. And part of that is we can then kind of report back to NHR on the types of levels of people who are applying. So that's part of our reporting criteria, if you like. But it also kind of recognises that people are at different stages of their careers and different levels of experience of research. And when we select, I'll talk about how we select successful candidates in a moment, but when we select those, we will be looking at them within those categories. So I guess the importance of this is that if you are just stepping into research and you're even just trying to find out what this R word means, you won't be judged against those who've perhaps got master's degrees or MReses or people who've got or who are in research roles. So that's kind of part of the reason for this. So one of the levels for our internships are what's called stepping into research. So these are for clinical practitioner or other roles, people with little or no research experience, and they want to take this first step into research, learning about how to engage with research and improve professional practice, and embed research in patient client care. For those who might be considered growing in research, so these are perhaps those in enhanced or advanced roles. So they might be wanting to develop the research pillar if they're an HCP, advanced clinical practitioner. People may have some training in research or they're in research roles, and they want to develop this kind of confidence and some of their skills in research. So they'd be the growing in research kind of groups. These aren't hard and fast, so you can see that some people might feel between the two. So we ask interns to kind of select the best fit, if you like. When we look at the applications, if we feel someone is very obviously in the wrong category, we will judge them in the appropriate category and let them know that. But we didn't actually have that in the last round. But yeah, again, so it is important, but it's not the most important part of the application, choosing the level or the category. So another level or type of internship is those around delivery, leadership and research. So these are for people who are working in research delivery or want to be involved in research delivery. And for this, we're very ably supported by our Southeast Regional Research Delivery Network in helping us select people from that group. So these are for people working in delivery leadership in research. And then our final level or category is our clinician or practitioner academic leadership. So these are people who are aspiring to clinical academic careers, who have research as part of their remit and wanting to develop their research knowledge and skills. So these are the people who might want to be going for funding applications sort of now or in the future. So again, these are the four kinds of groups. So really, it covers a whole spectrum of people's ambitions and skills and levels. So what can interns do? Well, the short answer is they can do a whole multitude of things because, as I said earlier, it's a bespoke and flexible program. So interns tell us what they want to use that funding for, but we anticipate that many applicants, particularly those perhaps in those stepping into research categories, may not have a clear idea about what they want to do as part of that. So, you know, perhaps what it's like if you're not really familiar with this field or what research is all about, you're faced with a blank screen. What do you put down? So we've developed a menu or types of opportunities that people could do, and I'll mention some of those in a minute. But I think what's important to note that list is not prescriptive or exhaustive. But it's really about stimulating ideas and opening up possibilities to advance research careers at all levels. And again, this is, as managers, is perhaps where you come in, so you can perhaps support and guide people in the types of things that they can do. So just as some examples of what people have done. So some people, dropping my notes. Some people have applied to do academic modules or training, and that can be within our region, or it could be online training elsewhere, or in-person training elsewhere. So they can use that money to do some formal training or academic study in research. Some of us interns last time around, not many, but a few, used the funding as backfill to undertake a placement. So, for example, interns who wanted to get into research delivery sort of had a shadowing or placement within a research delivery team or clinical team. Interns have used it for shadowing. So, you know, if there are senior researchers in the team, then they can, they can work with that researcher to find out a little bit more about what research is all about. Some interns have used the money to carry out engagement work or public and patient involvement to find out more about it, but also prior to further applications that they might want to put in. The money can be used for conference attendance or presentations. Interns might want to do a small audit or service improvement or knowledge mobilization kind of project, or perhaps work with the service transformation team, for example. So a whole range of things. Some interns have a kernel of an idea or an idea for a small research project they want to carry out. So again, sometimes it can be used for time and support to do that. So it's not prescriptive, but we have given some suggestions of how it can be used. But there is no kind of checklist from our point of view that you must use it for this, this, or this, but it has to obviously relate to research or knowledge mobilization, because that's what the funding is for. So I hope that made a little bit of sense. So these are really just some sort of some images of our category. So stepping into research, it can involve research training. They could attend a visit, for example. It could be some work around practice or undertaking an audit or QI project, as I said. It could be about networking and sharing. It could be about getting support from an experienced mentor to develop potentially a research career plan. So lots of kind of ideas. Similarly, growing in research, same sort of activity. So again, we don't specify that some activities are only for this category. It really just depends on what you want to do. Our research delivery leadership team. So, for example, interns could use this to undertake the Associate Principal Investigator Programme, for example. Again, it could be around networking and shadowing, finding out more about clinical trials in your speciality and how to build capacity in organisation. So a whole kind of range of things that people could do. And for our aspiring clinical academic, clinical practitioner academics, this could be working potentially with an experienced researcher, undertaking some research training, all sorts of things. So again, in those sort of areas around training, visits, focus on practice, networks, and getting further support. Mentorship is really, really important for research and for researchers, because it can feel like quite kind of like a lonely existence, really. So interns will be supported by a mentor. So often mentors will be identified by the intern as somebody they work with, either within their own organisation or perhaps a different organisation in their speciality. And we ask interns to identify a mentor if they have one on their application form. Some people may not have a mentor in that they can immediately engage with, and this is again where you as managers can perhaps help them support, identify who a suitable mentor might be. But if someone is struggling to find a mentor, then they can reach out to us here at the Academy, and we run a mentoring program which matches mentees and mentors. So if interns need it, we can match them up and identify a mentor. But I think it's fair to say that many or most of our interns will identify someone from their own area of practice. But again, we can support with that if that's a challenge for some. For those people who are doing academic modules, usually academic supervision is built into kind of the price of that module, if you like, if you're doing it at one of our universities. But again, perhaps our clinical academics are not necessarily undertaking training. So again, we will help them find a suitable academic supervisor, either through our university partners or someone else. And if interns do require academic supervision, then that will be funded in addition to that £10,000 that I've mentioned. So again, academic supervision is again really important for those who've got ambitions to learn skills, but also aspire to those kind of independent researcher and clinical academics. Peer support is also really important, and ArcKSS and our partners bring together all our interns online every other month, and part of that is to share their successes and what they're doing, potentially address any challenges they might have, or if they have need for further support. That's been working really, really well so far, run by Beth and the team. And I think what's important as well is some of our interns, if they have a learning need that they identify, then we can support that with sort of webinars and sessions as well. So, for example, coming up, our interns identified a need for academic or journal writing or journal publications. So we're going to run a small session on sort of how you might do that. So it's partly sharing, but it's also information and development support. But that's really driven by the interns and what they say they need. Towards the end of the internship, so coming up for us in the autumn for cohort 1, ArcKSS and partners, we will host an online celebration event. So this is where we get to hear from our interns about what they've done, and also the managers, so how they have supported and what difference they've made within the teams. So again, that is another form of support and celebration. So interns will be really well supported through mentors, academic supervisors if they need one, but also peer support with their cohort of 33 interns as we have this year. So I guess this is sort of preaching to the converted, because if you're here as a manager, because you're interested in the programme, that sort of implies that you are keen to support your staff applying for this kind of award. So if you needed kind of encouragement, I guess what we would say that really this is about supporting staff to apply. Not only helps build capacity, research capacity within your team, but it can contribute to organisational priorities, maybe around research quality and quality improvement, professional development, or if there are particular kind of areas of practice that is a priority area for development, it can be used as part of that. Interns bring back learning to improve practice. As I said, it can align with organisational priorities, and we know there's lots and lots of evidence, and again, I'm probably preaching to the converted here, but we really know that research active organisations and teams deliver better patient and client care. I mean, that's fairly well established now. So we know that it brings improvements, and we know that it helps with retention and development of staff. So there are multiple reasons why, if possible, we need to support our interns from us at the Academy, but also yourself as leads within organisations. The internship provides funding towards backfill. So again, interns don't have to use the money for that, but often they do. And we totally understand that this is a really big challenge for health and care practice. You know, there isn't the capacity in the system often to use that backfill in an effective way. You know, we chip away at that, but ultimately, this is about negotiation, and interns are encouraged to plan their workload to ensure continuity and minimize disruption. So the ARC Academy can work with you on ways to do this, but also I think this is really about conversations with yourselves and the interns around, okay, we want to support you to do this. What are the ways we can minimize the impact that might have on practice? And again, we've got examples of quite innovative ways of doing that where necessary, but there's no getting around that in a way. But again, we will do our best to try and support that arrangement, and I'm sure you will too. I'm going to hand over to Beth, if that's okay with you, Beth. This is the kind of nuts and bolts and nitty-gritty around applications, and Beth knows all about this better than me. So I will hand over to you, Beth. Do you want me to do the move slides on bit as well, though? Yeah.
If you can move the slides, because I won't have access. Thanks, Julie. Yes, so in the chat, I have dropped in the ARC Academy email into the chat, so you can see that there. It's also on the slides. The application deadline is 5 p.m. on 30th of September, so that will come up quite soon. In the chat, I've dropped in a link to the application form, guidelines, frequently asked questions, and the previous recording. When this recording is completed, then we'll be getting that uploaded onto the same web page. So when you circulate that, both recordings will be available. We know that we're going to get a large number of applications in. They will all be reviewed and decisions made within an 8-week period. There may be some questions that go back to any successful applicants and tweaks needed on the applications for specific queries. And then between all of that conversation and contracting with the organisations, the start date for the internships will be the 1st of February 2027. So that leaves a finish date after 9 months of 31st of October 2027. We have had previous queries and questions. If somebody wants to do a course or something along those lines that starts outside of those dates, do email us so that we can talk to you to see what's possible and what's available, so that you can still potentially have the award, but tweaking the timeframes very slightly. Next slide, please, Julie. So the form needs to be completed and sent to ARC KSS Academy, email address there. Do make sure that any applicants refer to the guidance. It's got a lot of detail about what's needed for each section, so it should answer the majority of questions. And if any sections are left blank on the application form, then our reviewers won't be able to make a decision on that section. We do have lay members in our selection panel, so make sure that people are writing these with a broad audience in mind, with a minimal use of acronyms, please. Next slide, please, Julie. After it's submitted, the assessment panel, including public members, meets, discuss all of the applications, and the things that they're going to be reviewing are the opportunities to support a career trajectory for someone who's building and becoming involved in research. How appropriate are the activities and plans for skills development? Are they achievable? Is it clearly explained and appropriate? Are there any opportunities for sharing the skills with the wider organisation? And how have the applicants approached public and community involvement and engagement and inclusive research? So what are the plans for patient, public, community involvement? And does it promote inclusivity as well? Next slide, please. So just to mention, the lead organisation for this programme is Sussex Partnership Foundation Trust. Sussex Partnership Foundation Trust, SPFT, will be in contact with the host organisation that will be hosting the intern to sort out contracting so that the contract can be put in place and that the money can be moved when the time comes to the organisation. Each organisation will be responsible for supporting its intern in spending the money that has been budgeted, and it's really important that the organisations, as Julie mentioned, work with the applicants to make sure that that budget is appropriate, is accurate for any backfill costs, so that it can minimise those delays to contracts in terms of getting that budget right. The applicants are asked to provide a contact detail for someone who's got oversight of that research or finance at the organisation, so they can provide that level of sign off for our contracts team. And we will be in touch with those organisations once we've got the awardee list, so that we can get that in place and processed before the programme actually starts next year. Okay, next slide, please. Thank you. Back to you or to us? To me, Julie. I think me.
Yeah, carry on if you're happy, Beth. I don't know.
I'm happy. Yeah. As this webinar is for yourselves as managers to support your applicants, as Julie says, it's really important that you talk to your line managees and the people who are wanting to apply. Think about it as part of their professional development for their developing their research skills. Work with them for who needs to sign off the agreement, and do work with them as innovatively as you can to think about those service delivery expectations and commitments, and being able to fit in the internship. And do provide space for sharing the knowledge and learning that the interns get back with the colleagues in the wider organisation. We do have a guide for managers available within the link that I've shared on the slides there as well, that you can circulate to other members in your organisation if that's helpful. Thanks, Julie. And as I've mentioned, the Academy team, we've got a combined email that's a shared email, ArcKSS Academy, there on the screen and also in the chat. That will reach myself, Teresa, or Rachel, and we will then either be answering your questions or triaging it with Julie and the wider team who support the HCP internship programme, so that you've got suitable support for your applicant or yourself as a manager for any queries you have. Thanks. Julie? So do check with your applicants that they're eligible, and if applicants are coming to you for queries, go through the guidance with them to make sure that their levels of eligibility. Think about who might support the applicants for their opportunities. Think about which level of internship best describes them. And bearing in mind, this is for people who don't hold doctorate degrees. So someone who holds a master's level with research is not going to be level 1 of research on the research scale here. They're going to be level 2 or be above. So help them describe their research experience. Have a think about with any activities that might be useful for the internship. As Julia said, there's a menu for ideas. Do come to us if you've got other ideas outside of that space and you need to check on it. There's quite a lot in the guidance about what could and couldn't work. And then if you're able to support people with their application, read it for clarity, make sure that it's answering the questions in terms of guidance. And do contact us if anyone is wanting one-to-one support for their application process as well. Thank you. Thank you. Okay, I'm going to stop recording and then we can take questions.
Lovely, thank you. Yeah, thank you, Beth. So over to you, really, with any